All right, so we are here with our roundtable with our wonderful clients, EverThrive, Ceci and Kristen. Thank you guys for joining us here.
Sure, thank you.
We've been working together for how long?
3+ years.
Yeah,
now.
October 2020.
2020, okay. And how many campaigns have we done?
COVID, flu, senior flu, adolescents,
And
NNIW, 5 going on 6.
Yeah.
NNIW again.
I think, Heather, you were here from a lot earlier than I think TJ and I were involved.
Yeah, so it started with the flu shot campaign back in October. And so I know that, we've had like almost 5 or 6 solid campaigns, but every single year we've like developed it more and more. So I think we're getting close to almost like 10 altogether, like with the revisions. I know.
Yeah.
It's pretty crazy.
So tell us a little bit about EverThrive. We talked about the campaigns already, but let everyone know what you guys do and yeah.
Yeah, I can kick us off. So we're a nonprofit organization that it's been around for over 30 years now. Our mission is to achieve reproductive justice in the healthcare ecosystem through community-driven partnership, policy action, and systems change. So we focus on a few different areas, including birth equity, immunizations, and healthcare reform, which includes adolescent health work. And so kind of a wide breadth of things that we work on, but all really focused on improving the lives of children, families, and those that are interacting with them. So Ceci leads our immunization initiative. I don't know if you want to speak a little bit more about that.
So within our immunization initiative, we really try to focus on individuals, Black, Indigenous, people of color, our priority communities, and really try to, throughout the campaigns, get messaging to, areas of the community in the Chicagoland area where there really is low vaccination rates. So our messages has always been trying to be around awareness and education and using the campaigns as one of those modes, in addition to conducting community outreach with community residents in neighborhoods, webinars, different areas where we can provide education both to community members and providers or, influential stakeholders within the healthcare system.
It's great. When at Fortress, we've worked on a lot of different clients, brands, startups, businesses, but it's always exciting when we get to work with, nonprofits like yourselves that are actually directly, we can see the impact of what's going on in the community.
Yes.
And so, when you guys were first working with us, what was the challenge or what did you see as the opportunity in terms of why you felt like you needed to pursue marketing?
Definitely. For us, we had always historically done campaigns on a very small scale, right? We're a small organization, small lean staff. So we would do, small budgets on reaching Facebook, right? It was pretty much our main audience. And we realized we wanted to have a greater impact, right? And we realized with social media being so influential, especially as it relates to immunizations, it's one of the primary modes that a lot of individuals get their information from. We realized we needed to have more of a impact through marketing campaigns. So we really were fortunate that we had at that point the capacity to venture to identify, consultants that could support us with developing a marketing campaign. And so our goal was really to try to level up and expand our services by incorporating this marketing campaign.
And how do you get the funding for a lot of your campaigns?
Yes. So most of our current funding is through governmental grants, within the state or within the city. Some private founding donation money, but primarily through government grants.
Our part of it, has been a lot of just like running the campaigns, the creatives, the website. Obviously, that's just one part of the greater marketing that you guys are doing, right?
Right.
I mean, it's a holistic. TJ always says it. He calls it the ecosystem. It's the word that we're adopting here,
which is part of our mission. Yeah.
Yeah. And so, what other things have you guys been working on in terms of marketing? I know you're a little bit more boots to the ground.
Definitely. I mean, I think outside of the campaigns, one of the components of our programming that we really use to influence and have some marketing impact is our community outreach workers. We leverage them to do community outreach through the different communities, attend community events. They're really the pulse of the organization. They provide that hyper local information on, how can we relay information to individuals in a way that they'll be able to digest and process, but also there's sometimes a disconnect from a public health standpoint and a community perspective standpoint. From a public health standpoint, right, we're like, oh, we need to start talking about flu as soon as like September, October it kicks in, right? But in reality, on the community side, flu isn't really thought of until about Christmas time, November. That's when really people start
coughing.
Right, getting, sick, and they're like, oh wait, maybe I should think about getting my flu shot, right? So really like being able to draw in that information and find a balance, right, between what we need to do as, immunization stakeholders within the public health system, but also how do we reach our community, so for us, in addition, because we have an organization that serves multiple focus areas, we're not limited to immunizations. We have a broader network, so we can tap into, using our birth equity partners to help, get some of that information or whatever resources we created out to those stakeholders. So that's also one of the ways in which we use to market our materials.
It's great. Like for us being a part of that journey, the website is obviously a big part of it.
Yes.
The campaigns we're running, but also designing a lot of the collateral that your team on the ground is using. And using QR codes, which is funny because you think that that's something that is dying out, but
Right.
actually people are still using it.
Yes.
And we're seeing that they're interacting with the pieces that you guys are printing. So that's pretty exciting. TJ,
Yes.
so I know you haven't been on a lot of our statuses, which you're missing out on probably one of the more positive. Yeah, like everything.
Feel it when you guys come.
Yeah, every one of these meetings is a lot of positivity and celebration, which
Absolutely.
You have a
is
happy hand.
Yes.
happy. It's
Definitely.
a new thing for me. First time I wasn't sure what to do. It worked out really well.
Yeah.
You've been running a lot of the campaigns behind the scenes. What are some insights or what are things that you have?
Yeah.
Well, first of all, what have you been doing?
Well,
What are you doing,
it's very
TJ?
complex. We run multiple campaigns in multiple languages, a very community-driven messaging, without saturating. It's one thing to just say, hey, let's throw money and get after it and go. But the differences between flu, COVID, and all the nuances, ages, mothers, children, all the different aspects that come with it, it really is complex. It's not just a megaphone that goes out. So all the different messaging on the ads, all the special landing pages that go to it, and really just making sure that experience for the person is easy to understand, get what they need, get more information, and be in contact. So really that's been our big objective. And what we've learned from that is the responses and the engagement that come from the ads is, like you said, very supportive, very positive. A lot of people, yes, do this, don't wait. There's a lot of good engagement among the online community, which you don't see very often. You see very COVID, it's a word that might trigger or something, that nature, but it is very positive. It's very, supportive of what you guys are doing. And it just shows that we're hitting the right people and making sure that they're getting there. So yeah, we do quite a bit. I think since the last couple of years, over 7 million people, we've really reached out, make sure that we're touching and they're getting that message. It's really incredible. It really is.
So 7 million
Yeah.
impressions.
Yeah.
Whoa.
Just from 2022.
2022.
Okay.
Yeah. We got more years prior to the data that we have this stuff. Yeah.
I was just gonna play a game to have you guys get how many impressions, but it's okay.
I didn't want them to go 20 million.
And then be like, oh,
No, but it's still really impressive.
Yeah.
And again, when you look at the radius that we're targeting, it's not all of Chicago, it's
Right.
not the whole area. It's a very specific, we want that message to really resonate, and felt like people are being heard. being communicated to.
Yeah, I think that's a really strong point to bring up too, is like this trackability, like, of the target markets that we're going for, because there's the select communities that we're really trying to, but how everything is working cohesively between like making sure that we have like the pixel codes in there, so that we can make sure that we're, communicating with those people, how we're going back, how your in-person team is, using those pamphlets, flyers, postcards that we're doing, all the QR codes, how those are being tracked together. Like, it's pretty beautiful how you guys have been able to think of like what you want to achieve, and then how we've been able to put all of these elements together to be able to make such an impact on the community. Because I know that's like your biggest desire is like the impact. We want there to be a communication, not only just like to get the information out there, but something that they can digest as well. And I know that's been a lot of conversations because there's a lot of information about everything that we're doing. So we just like how we're looking at the content, how we're visually breaking everything up has definitely been a focus too.
Yes, I think we can all agree we've spent a lot of energy in that space, and for us it was like really important to get that element right, because of the saturation of information that exists, right? Especially throughout the last couple of years as it relates to COVID. And how do we, especially when outreach workers have very limited time of engagement with another community member, how do we have a product that looks attractive, that looks professional, that looks like it's coming from a credit-worthy organization, right? But also is relatable culturally, right? And the material, like you said, Heather, is digestible. So, for us, that's one of the things that we're also most proud of, is not only have we created these campaigns, right? We've created these materials that, have grown and have now become more evergreen and have allowed us to use these in a, greater capacity and influence, I think, even other areas of our work, and thinking about, okay, the value that doing these campaigns has brought. We have data that we never knew that we were able to, look at and collect and can demonstrate to our funders, right? The impact, where this is who we're reaching, this is how many people have viewed us, and it gives us a better sense of like, okay, we're reaching our target audience, and that's important.
Yeah, I also think it's since we have that data, and we've started with the flu campaign back in 2020. Every single year that we've started doing that campaign again, we've been able to add, more value to it, because we're like, hey, this is what we've been able to target before, this is the results we were getting, and be able to, just build upon that.
Definitely.
When you think about, so Heather, you've been part of it from the beginning.
Yes.
Even from a design standpoint, how do you think things have changed or evolved as the campaign proceeded?
Yeah. It's so funny because I remember when we first started working together that you were just starting to work on your website. And it was one of those things where you're like, hey, we need a campaign. Our logo's being worked on, our website's being worked on. We don't have any of that information yet, but
we didn't have the style or color or something.
But we were like, okay, cool. And we took some time. We really like focused on like the energy that you guys were trying to portray. And our first design review with you, we came back and you were like, Heather, you're not going to believe this. You chose the exact same color that we just chose somewhere else without even having any of that collaboration.
That was
so
wild.
So it was just one of those things where we're like, yes, this is meant to be. We're supposed to be working together. But just seeing how everything has developed in the sense of like, how you're approaching things, like you guys even thinking more methodically on like how you're delivering that information and knowing like, the visuals matter, the different types of photos that we put in there matter. So I think there's been an education on both sides. We've learned a lot from you, and I know that you guys have learned a lot from us too, because you guys understand TJ's knowledge. And that's something that most people like that just goes over their head the majority of their time. But yeah, from a design standpoint, I just think that it just keeps growing stronger and stronger. Not just the campaigns, but EverThrive too. Because we've seen you like start as a smaller team and have grown so much in the last 4 years.
Yeah, there definitely has been so much growth. I do remember that, and we were so taken back, like, what? These are colors. These are gonna be our colors. And even just like you mentioning that, right, Heather, like it was me and another colleague at the time, and then we, got more lean, and it was just me for a long time with, you, and I was so grateful to have the Fortress team because I was new to developing campaign. This was all new to me. I didn't know what impressions were or any of it was. The language was all new. We had an idea, but we didn't have like a clear vision.
Yeah.
And I think that vision has definitely grown and evolved, and it's been through learning, like, okay, we can do A/B testing. What is that? And all these different nuances of the impact that you can do with a campaign that have been like so great, and for me has been such a growth and a learning experience that I'm truly grateful for. But and I think one of the things that I on a personal level I'm truly grateful is that COVID was a really difficult personal campaign for me to create. And I was so fortunate to work with Heather and, other team members at Fortress at that time, who were just also very compassionate with understanding that was difficult for me to, give my best self to that campaign. And so, I think I wouldn't have been able to get through that period that was so difficult without having such a great support team.
That was a great campaign that we worked on.
It was.
And it's great because we've got our team here, extended teams, but you guys do as well. And there's like every meeting that we're in, there's just so many people that are so passionate and so knowledgeable about really trying to communicate this effectively, to the community. So it's awesome that people are just so behind this mission and wanting to contribute to that.
Yeah, I'll say it's a challenge on our end, the copy, the language, right? Like when we talk casually, it makes sense, we're repeating back, but sometimes we're trying to reach people that maybe, especially the birthing people, they don't want it, and kind of approach a topic that is very difficult. COVID, even after all these years, still can be kind of, tough to decide what is what, and those kind of type of things. So you guys are communicating not only a powerful message, but a very complex message that is welcoming in a positive way, and to translate that into 10 words or less, to make that really hit. Our team A/B testing, and really just trying to refine that because, you want to make sure that journey, that everybody understands it, they receive it, they get it, they feel it, they understand it, they come learn more, and they have a positive, they want to support it. That's our goal.
Kristen, of all the campaigns that we've done so far, what's one of the ones that stood out the most to you?
Yeah, I will say the one I think I liked the most, well, maybe not liked the most isn't the right word, but the one that I guess stood out to me was actually the adolescent health campaign. And part of it is because that's my work background is in adolescent health, but I think that one was interesting to me because that was one of the ones where we actually had a website geared towards teens, and so there was one towards parents and then different messaging towards teens, which was very unique. And that was also the one where we created the video that we tried on TikTok. That was the only time we've ever been on TikTok, which is really cool, and that was really exciting for us. And so even though I know we got flagged and it had to be taken down at some point, but that 1 month of fame was really great on TikTok for us. So I think that's one of the ones that that's one of the ones that sticks out a lot for me, just because it was so different and unique, I guess, from the other ones even.
What about you, Ceci?
I would have to say COVID. I think we all know that COVID has been such an impactful period, right, in the world. And I think one of the things that really makes me truly appreciate our COVID campaign was the compassionate language that we used to relay information, and I think it's also was validated with hearing feedback from external partners that, wow, I've seen, quite a few COVID campaigns, but the way you address the loss, and the way you communicated in such a compassionate way made that COVID campaign stand out more distinctly than others. And so I think for me that demonstrates our ability to relate to folks, and meet folks where they're at, and be pioneers, right? And be very intentional and thoughtful about how to convey information to folks when the reality is that there's a lot of loss happening, and a lot of other COVID campaigns were just sort of glossing over that and just getting to information specifically about the virus and things like that. And it's like, well, we can't convey that information until we can reach people where they're at, and that's accepting and acknowledging where they're at, which is experiencing a tremendous amount of loss. So for me, that was like one of the most like impactful.
And I know that's a very, very personal,
Yes.
like a really personal thing, and when I think back on COVID in general, there was a period of time, even now, where people just don't know what they don't know, right? There's information and things coming from so many different directions, and I think people are still trying to figure it out as they go. So it's nice what you guys are doing, because you almost help digest what's out there and say, okay, look, I know there's a lot of maybe conflicting information, but here's what you should focus on, and here's the impact that's going to make. So I think it's nice because you guys have established yourself, throughout Chicago as well, that, we're going to help you digest this, and so that you don't have to feel overwhelmed by the number of, and even down to immunizations.
Right.
Like, you've got a child, like, I don't even know where to begin, right? So it's really nice that what you're providing, what EverThrive is providing, is something that's just not out there, but it's definitely needed. So, yeah.
No, I agree. Especially, I think, we learned, prior to COVID, and when we would talk about vaccines, it was either, you're an individual who has made the decision to get vaccines, or you're an individual who has chosen not to get vaccines, right? It was very black and white. And I think the reality is, as COVID, came to fruition, right, we realized that we can't label individuals who at that juncture had chosen to not get vaccinated as like, anti-vaxxers, right? It was just a personal decision that individuals were making because it was a scary time. It was, and for many people, for many reasons, they, may have chosen to not vaccinate for that particular, disease, virus, but that didn't define them as an anti-vaxxer, and so, yeah, for me, I was, able to, with my own loss, I lost my brother to COVID during that period, and it was really right before we were going to launch the campaign. And so, I took the information that I had from both my professional, my personal experience, and was able to like bring that, I think, forward to the campaign. And my brother was one of those individuals who had chosen not to vaccinate, despite us having a conversation about it, right? And so it really challenged me to be able to convey information in a more thoughtful way, right? And to that audience, because there was a lot of individuals at that juncture who had made the same decision, and a lot of families who were in the same predicament that I was, where we had an unfortunate loss, because the individual got sick and they had not vaccinated, so I think really being able to like take all of that and put that into a campaign, and reach people, is really one of the things I feel like I'm so proud of, and happy we had the opportunity and the capacity to do it with Fortress, because as EverThrive alone we wouldn't I think have had the impact that we had and the reach that we've been able to have with doing the campaigns with you all.
Any campaigns that stood out?
Blue had like double the click rate. I mean, in my world, like, I'm looking at those numbers and just seeing that engagement, seeing what's happening. And COVID, that messaging kind of goes out and it's still respectful. People are clicking, engaging, but the flu was like almost double. And then what we were saying earlier, just watching that, hey, you guys should be doing it now. We know, but then October, November, December, and then January, and then here we are. Seeing it really pop. So that's one that really stood out. It's just, seeing that connect with people going, oh, yeah, I'm the one there.
And I'm a very nostalgic person, so it's always going to be first campaign, flu shot, that created a lot of foundational things for us and kind of like opened the doors in our eyes to like, not only like, what do we want to do for this campaign, but then it started making us think about like, ooh, like our next one. Let's start
Yes.
with these things.
Yes.
So yeah, that one was very special to me.
I liked, so, you know, with a lot of our designs, we've been images, content, and then we've had these like brochures and things like palm cards, you know. But I loved that for National Infant Immunization Week, where we, you know, took it one level up and had that, you know, like almost like
Tripod.
that, yeah,
Yeah.
tripod, but also just the dynamic piece where you could just, you know,
Oh, the
so-
vaccine
the vaccine,
slider.
yeah.
Yes.
slider. I mean,
Yeah.
that was awesome. You know, just
Yeah.
being able to put that on any age and then have a list of all the immunizations. Like, that's so helpful. Something so simple.
Yeah.
But I love that we were just continuing, you know, in partnership with you guys, elevating and finding different ways outside of just imagery and the
Right.
content to try to, you know, bring more value to what we're doing. So I would say that's something that I thought was pretty cool that we got to do together.
Simple user experience
Yeah.
always has an impact.
Yeah. Yeah.
So what do you guys think about as you think on the upcoming year, the years to come? What are some of your goals? Where do you want to see EverThrive get to?
That is a great question, as we're really in the heart of our strategic planning for the next couple of years.
So not planning.
No, it's not. Literally, we had our strategic planning over the weekend and yesterday.
Yeah.
And we're still, you know, flushing things out a bit, but definitely, you know, we'll remain focused on birth equity work, you know, focus on just healthcare expansion, stay focused in the reproductive justice space, right? And I think what we're learning, where we specifically called out like increasing vaccine confidence, is that at this juncture, right, when we talk to individuals about vaccines, we have to have a more holistic approach, because there's a lot of other, you know, social determinants that are at factor before we can really engage in that conversation about immunizations. And so moving forward, we want to continue with that lens, right, of a more holistic approach to how individuals view their healthcare. You know, we did a focus group not too long ago, and one of the questions we asked people was like, do you see vaccines as part of your overall healthcare? And a lot of folks said no. You know, they may be, you know, individuals with diabetes or things like that, and they'll take care of that disease, but they won't view being up to date with their tetanus shot or whatever it may be as part of that healthcare. So, you know, for us, really thinking about, okay, we need to really change a bit of that language. You want to add to that, Christopher?
No, I mean, I think you said it really well. Just and I guess building on that and other examples, right? Like if people can't even access through public transportation, like getting to the doctor to get their shots, right, then that's something we need to like do work on if we're actually want to make an impact on vaccines. And all the other social determinants you were talking about, right? Like if people are just worried about where they're going to get their next meal, they're not going to prioritize their vaccines. And so exactly what Ceci was saying, like how do we wrap vaccines into this kind of like broader messaging about people's health, but and then also just like their needs in general to thrive and be healthy families. So.
You know, Ceci, when you were sharing a little bit about, you know, your brother, and that's it. When we think about COVID and vaccinations and immunizations, I do think that a lot of people just live in a little bit of a silo, right?
Yeah.
Like you don't think that it has an impact until it actually has an impact. And yet there are so many people that are lost loved ones or themselves have experienced things like this. So, you know, I think as we start to progress in these campaigns, bringing those stories out and being able to share more of that, I think is going to be powerful, because people need to see that there's, you know, there are people's lives that are being impacted just outside of the bubble that you live in. And then we take that story, how do we distribute that, you know, across different campaigns and websites, and just another way to spread that out. But yeah, I mean, I think that would be something for us to start to explore, is drawing those stories out and then using all of the marketing channels to really share that out, you know?
Yeah, that's personally one thing I'm really looking forward to in the future is like other mediums now.
Yes.
Like we know the strategies that are working. What else can we add on to the campaigns now? So it's exciting.
Yeah, definitely. And I think for us too, you know, we're thinking about how can we leverage, the community input and influence that we have to be those health ambassadors, right? And be champions in the space of policy. So I think for us, we would also love to see that, happen and become fruition of using community voices as part of our campaign strategy, so definitely we gotta chat more about that.
We'll have some more conversation.
Yeah. That I can't.
Yeah.
No, but yeah, thank you very much for being a part of the Fortress family, for trusting some of the messaging and marketing with us, and we're excited for what's to come and
Yes.
continue to get this out to everybody and make people more aware.